These are the two pages that I'm to read, page 50 and 51. Special circumstances. A note to all medications. A note: all medications cannot be cut or crushed. Do not cut or crush a pill that has an enteric hard shell coating, a capsule, or a pill that is sustained released or time released. The enteric coated pill has a protective hard shell coating that allows it to pass through the stomach without dissolving to be absorbed in small intestines. These medications are designed to be swallowed whole. If they are cut or crushed, they might burn a hole in the tube, esophagus, running from the mouth to the stomach, stain the teeth, or not be absorbed because the stomach destroys the medication before it gets to work. The capsule and sustained release pills are made to be absorbed over time, and if cut open, they lose that feature. Cutting or crushing these time release pills can result in the client getting an overdose of the medication because it is absorbed all at once instead of being released over a long period of time. There is an extensive list of pills that cannot be crushed. This is always changing due to new medications being released daily. Your instructor can show you a version of this do not crush list. However, you are not to have to make a decision about cutting or crushing a pill. Instructions will be clear on the MAR. Special needs. Some clients, such as older clients, mentally disabled clients, and younger children may have special needs when taking medications. If a client has special needs or needs medications administered a certain way, special instructions will have to be given to the medication aid. Allow more time when giving medications to clients needing additional assistance. If you are giving medications to a large group of clients, it might be easiest to leave the clients needing additional assistance to last, allowing other medications to be given before taking the necessary time to help the clients requiring more care. Difficulty swallowing. Some adults may have trouble swallowing pills and may need a different form of the medication. Older adults with swallowing difficulties may also require thickened liquids for medication administration. This information will be provided according to the agency's policy if a client needs special assistance. If the client is not able to swallow the pill or crush pill in food, contact your supervisor, RN, pharmacy, or the physician's office for ideas of alternate methods of administration. Administer medications to children. Children younger than 5 years old are too young to swallow a pill and will need a different type of medication. The agency should provide the correct preparation of the medication and measuring devices to allow for accurate dosing. If the medication is liquid, use only the measuring device provided with the medication to be sure the correct amount of the medication would be delivered. Before administering any type of medication to a minor, such as a child in a daycare or in a school system, the agency must have a written order from a physician. Also, a current permission form with the parent's signature is needed. Special instructions including the name of the child, name of the medication, dose to be given, time, date to be given, and special instructions on proper storage of the medication must be part of the instructions provided with the medication. A good policy is never to give a medication that has not been given by the parent at home first in case there is a reaction to the medication. Both prescription and over-the-counter medication should be the original container from the drugstore, which includes all parts of the label. Many pharmacists, if asked, will split the prescription into two bottles to allow one bottle for home and one bottle for the school. All medications should be in the childproof containers and stored in a locked container cabinet drawer. It is best to keep the medication in a locked area at the agency where it is to be administered, such as school or daycare center, versus sending it back and forth with the child to and from home to school or daycare. Prior to administering the medications, check to make sure it is not expired. Do not be lulled into giving Tylenol or other over-the-counter medications to a child without the parent's permission. If the child has a bad reaction, you will be held responsible for giving a medication that has not been ordered. When administering oral medication to a client who is a child, always put on clean gloves because you may come in contact with saliva. Explain to the parent or guardian how you would administer the medication so they can understand and assist you. Giving medications to a child is easier if the parent or guardian holds them. Gently hold the child's chin and slowly inject the medication along the side of the mouth, between the gums and the cheek, which prevents the child from choking and from spitting out the medication. Allow the child time to swallow and gently squeeze in more of the medication, excuse me. Repeat this until the syringe is empty. Wipe the child's mouth as needed. Take a few minutes to offer comfort to the child when you are finished. If you are not sure whether a medication has been swallowed, ask the client to open their mouth and check to see if the medications have been swallowed. Do not put your fingers into a client's mouth to check to see if medications have been swallowed, because you may be bitten. Always document the medication administration on the medication log or other documentation forms.